Hello and welcome to part one of my new series for February, where I'm going to help you to understand medical terminology and how to use it. This won't be an exhaustive list of terms, as there's hundreds of them and it can be a lot to remember. That said, I want to make it easy to understand how and why medical terms are written and used the way they are. So, to begin with, any medical terms generally come from Greek and Latin. Anyone that studies medicine of any kind will basically end up learning Greek and Latin. It's kind of inevitable. And most of the medical terms that we use are rooted in these languages. You might know Hippocrates is considered the father of modern medicine, and doctors take the Hippocratic Oath. So that's where it all comes from. So when you're putting terms together, you'll usually use it'll all be Greek roots or it'll all be Latin terms put together. So there's a wee list here of a few that you might have heard of. So if we look at nephritis, which means inflammation of the kidney, then that is from Greek, while renal failure of the kidneys, comes from Latin. So rena means kidney and nephra means kidney as well. So that's kind of how that works. And then you've got laparotomy, which is incision into the abdomen. That's a Greek root as well. So otomy means to make an incision into something. Means abdomen. So a laparotomy is where you make an incision into the abdomen. Enteropathy means disease of the intestines. That's also Greek. So entero means intestines. Pathy is a suffix that means disease, essentially. And then we've got one that's a bit of an outlier, which is jaundice. So that's yellow discoloration, which is caused by excess bilirubin in the blood. Can be related to liver disease, but can be caused by other things as well. But that actually comes from French for some reason. So you can find that there's two different kind of terms that are used for an organ or body system. And just to be aware that in the written parts of this and everything, I use the British spellings throughout. So things might be spelled a wee bit differently if you are from the US. Some of the kind of extra vowels get dropped in US English, but I will try and kind of point those out where that exists. So we're going to start with a couple of important examples. So we've got a pair of prefixes here that mean opposite things. So hypo means abnormally low or deficient, and hyper means abnormally high or excessive. It's very common for people to get these two confused because they have opposite meanings, but they sound quite similar, so it can be a bit challenging sometimes for people to kind of understand the difference, and it's easy to get them confused. So, for example, if you have hypoglycemia, that means that the blood sugar is too low. So, hypo means too low, glyce means glucose or sugar, and emia means related to the blood. So, you put those three together, hypoglycemia, and that means low blood sugar. And I have put a note there, the difference in the US spelling of emia, where the A is dropped, but in British English we use the A and the E together, so that's the difference there. And then another pair of prefixes that you have with opposite meanings, which is used in relation to the heart, and also can be related to breathing and other things as well. So tachy means abnormally fast. So tachycardia means fast heart rate. Tachy is fast, cardia is the heart. And then bradycardia is the opposite, which is abnormally slow. So bradycardia means a slow heart rate. Sometimes you can get qualifiers or adjectives applied to give more detail. So supraventricular tachycardia means that the cause of the fast heart rate is above the ventricles of the heart, so it's originating somewhere above the ventricles that's causing the fast heart rate. So, when you're doing medical terminology, sometimes a lot of adjectives and descriptors and things and qualifiers get added, so that's why it can get quite complicated, especially if you're new to the whole thing. Another term that is often misunderstood is psychosomatic, all in your head, question mark. So psychosomatic is a term that a lot of people misunderstand the meaning of. So we'll break the word down and then we'll talk about what it actually means. So psycho is something that means related to the mind or the psyche, and that comes from Greek, and soma or somatic means it's related to the body, which is also from Greek. If you've ever played the video game Soma, which it deals a lot with the kind of issues of identity and mind versus body and that kind of a thing. And that's probably why that game was titled as Soma. But if you put these two together, then you get psychosomatic. So what that means is that the patient is experiencing physical symptoms that are related to a mental health problem. What it does not mean is that they're making it up or imagining their symptoms. The symptoms are very, very real and they are absolutely happening. The issue is that the cause is psychological rather than physical. So, most common example that people might experience is a panic attack. So, when you're having a panic attack, your heart's beating really fast, your breathing's really fast, your chest feels tight, your pupils dilate, lots of changes, which is related to your autonomic nervous system. So, these physical things, they are real, they are happening, but it is related to the mental state. It does not mean that the symptoms are being made up, or that the symptoms are all in your head. So, just to make sure that that's very clear, psychosomatic means that physical symptoms are being caused by a psychological issue, a mental health issue, that kind of thing. So, they're quite real. It's just the cause that's important. So, that's what that means. But it is something that is commonly misunderstood. And I do understand that some doctors do tend to blame all kinds of issues and just say it's because you've got anxiety, whether that's true or not. So I do understand that. But psychosomatic means it doesn't mean that the symptoms aren't real. Psychosomatic means the symptoms are real. The physical problems that are happening are real, but it's a psychological cause. So that's an important one. And then one that's a bit of a bizarre term, which is a teratoma, the monster. So terato means monster in Greek. So what's that got to do with medicine? Well, there's a couple of uses of this prefix. So teratoma is a specific kind of tumour, which translates literally as monster tumour. So oma is the Greek suffix, which we will get into those suffixes later on, but oma is a suffix that means growth, so generally used for benign growths, whereas things like carcinoma or sarcoma are used for nasty kind of growths. So any kind of tumour, and tumour doesn't automatically mean cancer either. It can, but it's a bit of a complicated one. That's a subject that we'll cover in detail down the line. But teratomas are interesting because they have differentiated cells. So they originate from what are called germ cells, which are cells that have the ability to be differentiated into any cell type. So they're cells that could go and turn into a muscle cell, or they could go and turn into a skin cell, or they could go and turn into a liver cell, that kind of thing. So that's where these tumors originate from, these kinds of cells. So they've still got the ability to turn into any other kind of cell in the body. So oftentimes with teratomas, you'll find that there is several types of tissue inside them. And you may have heard of these, that you've got these tumours that have hair inside them, that have bones, teeth, and muscle tissue, and they're very, very bizarre. The most common location to find those is in the gonads, where there is a lot of these germ cells. So it's quite a common one to find on ovaries or sometimes in testicles as well. But that's what the name means, because obviously when people first saw these things, they thought there was some kind of monster because there was teeth and hair and stuff inside them. So that's where that comes from. They're definitely kind of a bizarre thing, so it kind of makes sense. And then we have a bunch of prefixes that are specific to different things. So things like colour, position, organ type, and quantity, which will be covered later on. So next week we're going to be getting into some of the suffixes of medical terminology so that we can start putting together some words and you can kind of understand how these things work and why it's important to have this system that's kind of standardized across the board, because it really helps with sharing knowledge and research and things as well. So hopefully you found this useful for beginning to understand medical terminology. It can get complicated and it can get confusing, so I'm here to help make it all easier for you. And if you do have any specific questions, let me know in the comments. I obviously won't give out any kind of medical advice at all. My background is that I was a veterinarian for 15 years, but I don't give specific medical advice. But when it comes to advice for kind of fictional issues and questions about certain words, then I'm happy to explain those and to help with those if that is something that you need. So let me know. And if you want to see more, subscribe. You can expect these kinds of videos going through various things and going through support and advice and things for writers, and also you will get some behind the scenes and things as I work through my debut novel edits and things like that. So if that's something you're interested in, then hit that subscribe button and I'll see you all next time. Bye.